Hi, Charles 200. How are you? Um, Today, we're going to combine our efforts in doing our lecture today and our topic this week. Again, this is instructor view. So your student view is going to look a little different, but it's the same drill. You just come down here, you click on here, okay? And all right, and you find this week's topic, and hopefully all of you were able to watch the Theories of Aging, watch Julia's discussion about reproductive issues, which were really personal, and I think that makes it hit it home a little harder, which is awesome. And then we have right here this week's topic, which is cancer. I know this is a difficult topic for a lot of you, um, and the likelihood that you're going to know somebody with that has had cancer and they're a cancer survivor or they're dealing with it right now is pretty likely because we look across the population and about over your lifespan you have a 1 in 3 chance about that you're going to get cancer. So that means a lot of the people that go through your life are going to be dealing with this. So the video is going to go right here, okay? And so it is a scary diagnosis, and Julia's here to talk about it a little bit because of her own personal journey through this. If you watched the last video, you saw Julia down at Moore's Cancer Center down in San Diego, and she was getting an infusion, right? And the infusion is to help her because she has an immune system cancer. And so her immune system is not quite what it should be because the cancer wreaked havoc on it. And then the drugs that she took to treat the cancer, there's no free lunch on them. While they really help to kill off a lot of the cancer cells, they also killed off a lot of the good guys. And so she has to take drugs to supplement her immune system.
Can I jump in?
She can jump in.
Okay. So I asked John if I can piggyback with him this week because I'm pretty excited about the material we cover every week, but this week I am especially excited because these are two issues that I have a lot of passion for: cancer and it's going to sound weird, but death and dying. And I've got personal experience with obviously as a cancer patient. And one of the things, we try to give you theoretical information. So we're going to cover statistics. We're going to cover, how does cancer work and proto-oncogenes and oncogenes and things like that and tumor suppressor genes. But I also want to give you something practical. And so one of the things I want you to know when you look at these statistics is that they do not take into account the treatments that have been approved in the last couple of years that have really revolutionized cancer treatment, like Keytruda, which has only been approved in the last year, I think, for lung cancer and a few years before that for other solid tumors. So we're seeing a revolution right now. And these statistics, you'll notice it's a look back and they go through, I think, 2016. So if we could fast forward a few years, I think the numbers are going to start looking a lot different for some of the cancers that have been very, very difficult to treat in the past. So if you have a family member or if you yourself have had a cancer diagnosis, know that there's a lot of hope for effective treatment. So
And the revolution went from the standard care forever was really hard and really difficult, but it was surgery, chemotherapy, and radiation therapy, and that was pretty much the sledgehammer that was used for treating all cancers. And it was a real tough go. Now there's these therapies like Julie talked about. The Keytruda is a targeted therapy that basically it keeps the cancer from shooing away the immune system. The immune system normally goes in there and attacks the cancer, but the cancer is very nefarious, and then they develop the drug to keep this cloaking device from happening. And there's all these new targeted therapies, antibodies that you infuse or a pill that you take that just inhibits the go signal. And we're going to talk all about all that. So and is like Julie said, she said death and dying was a passion, and you guys can you have to kind of monitor your own feeling about this, be your own barometer in terms of what you want to say with the death and dying. If cancer is too difficult for you to talk about, you can talk about something else. We scroll down here at the very end. We're going to come back to this, and this is the death and dying part. It's in the discussion. So we go all the way down there. Here it is, right here. It's appropriate because you go through the stages of grief even when you just get your first diagnosis. When you've had your first diagnosis with lymphoma and leukemia, we went through DABDA. Um, when I started to deal with my arthritis and my knee surgeries and shoulder surgeries. These are hard things. When you break up with your boyfriend or girlfriend, you go through all this stuff. So it's very applicable to all these things. Okay, so
There's many kinds of loss that you can experience.
right.
Maybe you took a class and didn't do well in that class, and this image that you had of yourself that, oh, I was going to be an engineer, I was going to be a lawyer, and you might have to start adjusting your life goals, or not.
Yeah.
But you can have a lot of different types of loss, and they're all very genuinely felt.
All right. So what we want you to do is just kind of show some curiosity. So you click right here onto the cancer.gov website. Get my head out of the way here, and there's some lots of different ways to navigate this. Okay. Cancer types right here. You can list all the cancers. So if you have a curiosity in each cancer, you can go in there and research it. Also, these are the targeted cancer therapy that I was talking about, the new wave approaches. So you can click on that. You can get involved with the National Cancer Institute, subscribe as indicated here. And then down here, this is a really cool way to kind of navigate what's going on. Okay, what is cancer, for example? You just click right there, and it takes you to a description of what causes cancer. And we're going to get into this, and it's going to talk about the eruption of growth and the lack of kind of a inability to get rid of dying cells, and that's called apoptosis. And we're going to talk about the brakes and the gas pedal and how that approaches. Okay, this just talks about metastasis, on and on and on. So I'm just going to go back here in the browser, but you can get in there. You can talk about prevention. A big thing that we're going to see when we look at the charts, a big thing to do with prevention is diet, exercise, smoking, these kinds of things. Diagnosis, staging, prognosis, treatment side effects. Finding a clinical trial is enormous. Okay, so if you know somebody that has a recent diagnosis of cancer, you get the state-of-the-art treatment. So Julia just finished a 3-year clinical trial, and so people like Julia are heroes when you do that because, well, you're using your body as a lab rat. You're a test tube, and she the 2 drugs were FDA approved, but they had never been used in combination before, and there were side effects. And they learned from people like Julia for applying it to future patients in terms of their standard of care for treating cancer. So, all right, I just want you to kind of to be aware of this and to show some curiosity. Okay, so we're going to go back to our page, and then we have another page right here that is the statistics. And what we've done here is we've kind of shown the statistics. Okay, and we see lots of decreases in death rates. Okay, we see decreases in the incidence, and this is the number of people that get a cancer per 100,000 population of the rate. So it's in the I say increase in IN. That's how I remember this. Okay, so this is the new cases. Okay, you can hear my dog flopping her ears in the background. It's Bella. Okay, and she's gonna start like growling at Julie now. she talks to Julie. Anyways, okay. So anyways, we can go to this report right here. Okay, it's a statistical analysis.
And this
okay?
report comes out every year, so it gets updated usually April
Every
or May.
single year. I told you she was gonna start talking to you.
I'm gonna let her out.
You're gonna let her out. Okay. That's the dog demanding attention. Okay. So you can see that overall we see this declining in death rates, and this because of the new treatments, new approaches, clinical trials. Okay, and so for the most part we see these decreases and decreases. Okay, however, some are really hard to battle. All right, so these are the decreases in death rates, but these ones the death rates have increased, and part of it is why is that happening? Well, we do have problems in terms of environmental exposure to things. Okay, whether it's bad water or bad diet, and alcohol is another one, right? So this is how you read this, and so it talks about the new therapies, and there's, if you guys are business majors, there's been no bigger explosion in terms of big pharma and biotech in cancer treatments. Okay, and so this is a good place for your investing. It's also a good place in terms of marketing, things like that. Okay. Smoking was one of the biggest epidemiological findings ever. And what smoking is all about, they basically watch people come in with cancers, and they tried to figure out what's going on, why, and they start connecting the dots, and lo and behold, hey, people that smoke cigarettes are getting lung cancer. The same epidemiologist said people that smoke cigarettes are getting heart disease, and that's a whole different story. Okay, and so as we have better education, okay, as a society, and we get rid of cigarettes, then cancer rates begin to go down for lung, bladder, larynx. We have a new problem, okay, and that's vaping. Okay, there's been no studies on that, and I guarantee you, within your generation, we're going to have similar outcomes in terms of epidemiology that we found with smoking. Alrighty, so this comes down here and it looks at national trends of new cases, and I'll show you can enlarge the image if you wish. Okay. But again, there's some winners and there's some losers, and you have to just kind of ask yourself what's going on. These are just statistics; they don't explain, why the trends are going there. But then they come down here and they say something right here. This is something you can grab hold of. Okay, we have an obesity epidemic in our country, and one of the greatest risk factors for cancer is obesity. Your central tummy fat, okay, also called visceral fat, is this crazy inflammatory organ, and it sends out all these special cellular messengers that will stimulate cell growth and stimulate cancer. Okay, and so this is why we have to really, change our approach to life. Okay?
Can I jump in?
Yes, you can.
Okay. So the line right there talks about what could cause higher cancer rates in men than women, and one of the things they talk about, higher rates of tobacco use, occupational exposure, and infection with oral HPV and hepatitis B and C. So there is a big trend among baby boomers, so people older than you, but possibly you too. People who are infected with Hep C are at higher risk for liver cancer. And it's been an amazing thing for me to see the change in the last 10 years, because I have, two boys that are 24 and 18 now, with oral HPV and HPV vaccines. And I read an article today, Australia is going to eliminate cervical cancer in Australia within the next couple of years. And it's unprecedented because they've had a big education campaign. They were offering free HPV vaccines to initially young girls, and then extending that to young men. And I think the key thing for you to know at your age, what you can do to decrease your cancer risk, is getting the HPV vaccine, which is approved by the CDC and the FDA up to, I think, age 26, can go a long way towards decreasing your risk of cervical cancer, oral cancers, anal cancer.
I had a good friend that got throat cancer, and
Yeah.
it was just because of his intimate relationship. So,
Yeah.
it's pretty simple. You get your HPV vaccination. Are there two or just one?
There's two different types
Right.
of HPV vaccines, but
Right.
it is a series of shots. I think
Right.
you get
Right.
one and then you
Right.
get another one 6 months later. But it's a nice thing to do. And men initially weren't participating because they thought that's not my problem.
Yeah.
But it is your problem
Ultimately,
because you
it
can
is.
also get cancer from HPV.
Absolutely,
And so
like my good buddy.
I would love to see us eliminate HPV related cancers in the US.
It's pretty easy. You just go and get your vaccination, and boom, that's it. Okay, because the reason it works is it's human papilloma virus. Okay,
Yeah.
so you're just by vaccinating, then when the real deal comes in, your immune system is all supercharged, and it goes after it and attacks it and gets rid of it. Okay, all right. So these are the same charts. Okay, we just took them out in case you didn't want to go in. Again, you can look and ask yourself, what's going on here? Why are these going up, and why are these going down? These are just statistical reports. Okay, all right, and this is the kind of cancer that Julia has right here. All right, okay. 5-year survival rates. Okay, these have gone up. Okay, across the board, and this is all good news. Okay, and then you can look at disparities. Okay, and so we have a couple people in the School of Gerontology that look at health disparities and ask what is going on here. Reggie Tucker-Seeley is one of my good buddies, and he's looking at health disparities and across ethnicities, and you do see this change. Okay, so we see here survival rates. Okay, and we see that Black patients on average are not doing as well as white patients.
So melanoma is a big one.
Yeah.
Uterine cancer is a big one.
Right.
So there's pretty significant gaps. The gaps are narrowing, but this is another area where I have a lot of passion, because as a cancer patient, I can see how difficult it is for people to navigate the system and access healthcare. So we are seeing these treatment gaps based on race, based on ethnicity, based on socioeconomic level, and based on whether you live in a rural area and can't access healthcare. Right. So we need to address this in our country. And
part of the reason that she did pretty well, because she had a really aggressive form of lymphoma, is that we were able to go down to the premier institute, arguably in the world, down at San Diego. And we had great insurance, okay? And we were able to access it easily. Whereas a lot of other people, you don't have that access, okay? You go to if you're lucky, you go to your local oncologist, and they really don't. They're not specialized enough to understand each of these individual cancers. You got to go to a specialist that specializes in each type of cancer to get the best possible treatment.
And we do have cultural differences and education differences in terms of how people access healthcare and whether or not they trust the doctors. Yeah. So we've got to do a better job. For those of you that are going to medical school, we've got to do a better job of helping those patients that might not have good experiences with the medical establishment get in there and get diagnosed and get treated.
So you can find your group that you identify with, and this is the increase, okay, in rates, okay, and we're looking right here the incidence, and then we're looking at mortality rates. Okay, and just you can just see how you stack up. Okay, we're looking here again at the incidence. Okay, so that's the increase in number of new cases per 100,000, and then we're looking right here at death rates. So you just kind of scroll through that. Okay, alrighty. Again, this is the page we looked at. You go to read up on cancer right there. I'm not going to click on that again. It's the same thing. This is a PDF file, okay? That is the same thing that we saw earlier. And then we come down here and we have a couple of videos that will give you a real nice overview of what causes cancer. There are quiz questions about the key driver genes. So we all have genes that are growth, okay? You got to grow new skin cells every couple of days. You have turnover in your stomach and intestinal cells that are every couple of days, and so you need to have growth in the stem cells that will produce new cells. Okay, these are called our proto-oncogenes. Okay, when, however, the growth goes from just every couple of days to every 2 seconds, okay, something's gone wrong with that growth gene, and it goes from a proto-oncogene to an oncogene. And this is just too much growth, foot on the gas pedal, go, 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 go. Okay. We also have a system of checking for damage. And when cells, especially cancer cells, they're not made right. And so normally we would be able to detect them, okay, and we tag them and we say, you're out of here, and we kill them off, okay? And there's a whole set of tumor suppressor genes that are surveying all the time, trying to kill off the bad ones. But sometimes you can get a mutation in this tumor suppressor gene, and you won't kill off any more of the bad ones. So it's go, 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 nothing gets killed. And the longer cancer cells stick around, they get newer and more crazier mutations that make them even harder to kill. And so that's why early intervention is important. The most common mutation in all of cancers is this tumor suppressor gene. It's called P53.
Okay. And elephants have many, many copies of P53, and they don't get cancer, right?
Yeah.
So there you have it.
Okay. All righty. So that's everything, guys. So again,
we didn't talk about death and dying.
Okay, she's been talking about, but that's everything on cancer. I'll let her do the death and dying. Remember, open the browser twice so you can take your quiz while looking through this stuff. Okay. You're more than, it's okay for you to do your quizzes with your friends, to study with your friends. We encourage you to get together as groups, okay? And then here's the death and dying. And so I'm going to let her go.
Okay. So our discussion is about death and dying. We have an alternative assignment because some of you have probably experienced loss recently and in a difficult way and may not want to talk publicly or on the discussion board about that. And that's totally fine. We understand that. So if you are not comfortable participating in the death and dying discussion, email me and I will give you an alternative assignment. The classic approach to loss and grief and death and dying is in this video, Elizabeth Kubler-Ross and the 5 stages of grief. You may find that this doesn't resonate with you, but this is just one approach to how grief works. And you can go through the phases of DABDA, what is it? Denial, anger, bargaining, despair, acceptance, over and over again. So you might go to a phase and then skip a phase and then go back 2 steps and get caught in this. And so I lost my mother. Whoops, the dog is here. She's a good girl. She's a really good girl. Okay. She's a really good girl. Sometimes.
I'm sorry, that was a serious thing.
I know, but you know what? You got to take joy in life where you can get it, for sure. Anyway, I lost my mom suddenly a year ago before Thanksgiving, and had always been kind of interested in death and dying issues. And of course, then I had to live it and live the grief of losing someone that you love very much suddenly. And so I do have a lot of empathy for people that are going through this, and everyone grieves differently. There's no right or wrong way to do it. Getting support from people around you is great. But just do what feels right to you. Do what you need to get through your grief. And
I was very supportive of Julia, and she was. And then 2 years earlier, my mom died, and she was there for me. And that's what friends are all about. Seek out your support group. Always seek out your support group, no matter what your issue is.
Yeah, and we're big on logical families, meaning that you may not have a family group that's supportive on a particular issue, but you can surround yourself with people who get you.
My closest family member is Glenn Flores. Okay, we grew up together. He's not Irish like me. Okay, but we met when we were 10 years old, and we're brothers. So.
Okay.
All right.
So sorry to keep this so long. Hope you guys are doing well. If anyone has any questions, if anyone in the class is a cancer survivor, or if you have a relative with cancer and you want some advice, reach out to us. We can certainly connect you to resources. And we're always here for you guys.
Absolutely. All right. We'll see you guys next time.